So actually, my practice is split now between the UK and the Middle East, and because I'm a speaker for many companies, this is how I came across the technology several years ago in one of the congresses, and I was quite interested because I know many of my colleagues used to use LED therapy. However, it wasn't that specific one, which is the Omnilux brand, which is a medical grade LED. By the way, LED stands for light emitting diodes, and it's quite specific wavelength light, which targets many skin levels. We're going to speak about that later on. And because it's the only FDA approved technology, this is why I decided to stick to it, and I've never regretted it.
What exactly is LED light therapy?
Okay, so the LED, like I said before, is light emitting diodes, and these are quite specific light with specific wavelength that target many skin factors. First, it's a wavelength that targets the fibroblasts, which means it stimulates collagen synthesis. And second, it targets what we call the mitochondria in the cells, which leads to energy recharge in the cells, which means more regeneration, more skin regeneration, more youth, more rejuvenation, and same time it gives lots of skin hydration and more skin plumpness. It also works on anything related to the skin complexion, so it helps us unify the complexion and take away all these imperfections and all these small freckles we've got. So this is what I call a complete rejuvenating system.
Is it really true that the mask technology is as potent as the claims are? Have you found in your use and in your clinic? Yes. Tell me about that.
It's exactly the same power. It's exactly the same power. And as you said, because it's a home use device, patients are more compliant. It's like their peaceful moments at home, like these 10 minutes wearing their mask or listening to their music. It's like a treat. It's like a spa treat at your own place. And we've got literally the same results as when we use it at the clinic. It's same potential, I'd say.
Why did you choose Omnilux, and what's unique about the technology of this mask that you like?
Well, actually, because I'm a doctor, I like what's clinical study based, and because they've got the FDA approved, that shows you how the company is serious about their technology. Like, it's been endorsed by many clinical trials, and we've seen like visible results and measurable results with many techniques. So this is why I only rely when there are studies, when there are endorsements, when there are articles, and everything was made by doctors. So this is why I truly trust the technology. And even clinically, when you see the results, you don't want to shift to anything else.
What are the benefits of having an adjunct light therapy treatment with whatever else you're doing? So topical treatments, lasers, and creams?
This is like the most versatile technology I've ever used, because I can combine it to pretty much everything. So even if I'm offering a chemical peel for someone suffering from sun damages or from melasma, definitely the LED therapy can complement and gives better results and longer lasting results. And as you said, hydration is definitely increased by the LED sessions. And by the way, the clinical trials that we've done is only about 10 minutes 3 times a week, which is not like quite much. So for 4 weeks, we've had 28 patients using the LED therapy for 10 minutes only 3 times a week. And we've seen a level of hydration quite increased, along with other factors like the collagen percentage and the skin thickness and the skin aspect as well.
And is that instant glow part of what's going to come? Because if we're talking about collagen induction, I'd like you to talk a little bit more about the science of collagen induction with the LED therapy.
Yeah, because actually this is one of the wavelengths that targets specifically the fibroblasts, which are the cells responsible for collagen synthesis. And because this leads to energy recharge, so these cells become more active. And this is why we see a more active collagen production. And of course, this needs to be accelerated specifically at a certain age, but even young people could benefit from such a technology.
What are the applications for the mask with regards to adult acne and also scarring from acne?
Well, scarring from acne is a bit different, because scarring from acne, this is where we need collagen production and where we need regeneration to help remove the scars. However, for the acne itself treatment, it's another kind of light. It's the blue light, which is now undergoing clinical trials, and soon they're going to be definitely having the FDA about it. And it's because it was proven that the blue LED light has anti-inflammatory and antibacterial properties, and this is why it would reduce the outbreaks and help heal the acne outbreaks, and of course along with the classical acne treatment, but definitely a huge benefit of combining with the LED blue light.
Do you do other collagen induction treatments in your clinic? And do you find that that is the key, the cornerstone of age management and rejuvenation?
Yes, honestly, the only thing I used before the LED was the IPL, because I've had it like many years ago, like when I started my practice. It used to give me good results. However, it's about having someone doing the session. It's about people coming over and over again. And it's not like quite pleasant because it's a pulsed light. And when we see the same result with such a softer technology and with much more clinical endorsements, I would definitely stick to the LED for now.
Are you able to use the face masks on other parts of your body?
Yes, actually, there are other masks for other parts of the body. Now they've innovated the one for the neck and the décolletage, and it's like a massive success now. And lately they've released the gloves for hands rejuvenation, and I think this is of a huge success in countries where you've got lots of sun exposure, because when you're driving, when you're walking, you always maybe think of the sunscreen on your face, but you always skip it on the hands, and this is where most of the age signs show. So even if you've got multiple rejuvenating treatments on your face and you don't care of your hands, they will always be able to tell your age.
They sure do.
Yes. So the neck and the hands mostly tell someone's age more than the face, because this is where we take mostly care. It's the face. So doing the gloves and the other device for neck and décolletage, I think, is like a real boom in medical aesthetics.
With the mask, what is the protocol for using it to get the best results?
The skin has to be extremely clean, well washed and well dried. And you could also potentially enhance your results while using the hydrogel mask that comes along with. So you can put it on your face and then wear the mask above. This is where you've got mostly the ingredients of the mask penetrating the skin along with the LED technology. And some other people prefer to use the mask after the session as a hydrating and soothing treatment. Both protocols work.
Can you explain to the listeners the difference between normal pigmentation and melasma? Because there is a lot of, questions around which is which.
Yeah. So actually the melasma is when you've got like real stains. It could be due to the sun or anything else. And this is where you know that the immune system of the skin is not working enough to eat or to destroy the melanocytes or the melanin that's being built up on the skin. And this is when you've got lack of this immunity response, where you start getting stains. And this is where you need like a chemical peel to help your skin take out all these freckles. Wherever the pigmentation, it could be like a small skin damage. And usually we see it in young people who are starting to have it's like a predisposition to melasma, but because you're young, you still have some immunity to destroy more the melanin being built up on your skin surface.
If you had to invent, or if you could get your hand on the most exciting anti-aging technology or technology for rejuvenation, what is Dr. Hany's wish list or dream device?
Well, to be honest with you, I'd ask for a full body suit of LED to wear. So you could definitely boost your collagen everywhere and have the best prevention for aging along the years. So yeah, why not?